Welcome everybody to this session. My name is Ami Bishop.
I don't know if we've quite clicked live yet.
Okay.
I'm gonna leave now. I'll deal with it, and we're gonna get started very soon. Have a great session, everybody.
Okay.
Okay, people are coming in.
Okay, great. Welcome everybody. It's so good to have you join us for this session. My name is Ami Bishop. I'm a global health and human rights consultant and currently serve as Outright's senior research advisor. This session is entitled the Global COVID-19 LGBTIQ Emergency Fund, Stories and Lessons from the Front Lines of the Pandemic, just to make sure you're in the right place. So today we have a really amazing panel who each will be sharing their stories with you. They're all are recipients of the emergency fund. And so we are going to hear more about their current circumstances in their settings with regard to the pandemic and how they use the funds and what they have been able to accomplish. This panel, just for everyone to be clear, is 50 minutes long, so we're going to move rather quickly. If audience members have questions, please post in the Q&A tab rather than in the chat tab. We're having a little bit of difficulty with the chat tab, apparently. So Q&A tab is the place to go for putting in your questions. Now I'd like to go quickly to introductions. I want to note that below your screen, those of you on Feedloop, the full biographies of each of the speakers, they are there. And so I'm going to ask each of our panelists to just very briefly introduce themselves, their affiliation and where they are. So Sharon, can I start with you?
Sure. Hi, everyone. I'm Sharon Cox. I'm the Health and Support Services Manager at Triangle Project, based in Cape Town, South Africa.
Thank you, Sharon. Welcome. Binta, how about you?
Hi, my name is Fatimata Binta Sal, and I'm the Executive Director for Sisters for Sisters, Liberia. I'm from Liberia, East Africa.
And I see you're outside in Liberia. I hope it doesn't start raining or anything. Dana and Yasmin, please go ahead.
Hi everyone, my name is Yasmin Rifai and I'm the Creative Director at Haven for Artists, cultural organization based in Beirut, Lebanon.
My name is Dana Ash and I'm the Executive Director of Haven for Artists.
Great, welcome both of you. Bea, please.
Hola a todos, buenos días en Perú, les saluda Bea IS, soy una persona intersexual, vengo coordinando la organización Perú Intersex, que es una organización que trabaja por los derechos de las personas intersexuales en Perú, y ahora vengo representando a Brújula Intersexual, que igualmente es una organización que brinda información y contención para personas intersexuales de México y toda Latinoamérica. Muchas gracias.
Thank you. Welcome, Bea. It's great to have all of you. Before we get into our discussion, I just want to take a few minutes now to provide a bit of context for the session. As some of you might know, very early in the pandemic, we at Outright undertook a rapid assessment on the impact of COVID-19 on LGBTIQ lives, which we published in May 2020. So again, quite early in the pandemic. But even so, the findings were really startling. And since then, many of the findings have continued to sort of be corroborated and replicated in other studies and in other settings. What we realized at the time, when we were hearing the stories we were collecting, was that the reality was that if we didn't step up and actually figure out a way to support communities around the world, that support just may not be forthcoming, at least not quickly. And so we decided at the end of May 2020 to mobilize funding and launch a global COVID-19 emergency fund. So I just have a couple of, just very quickly, a couple of slides to give some background about the fund, and then we'll turn to the conversation. So one moment while I pull up my slide deck here. So just to give you a quick snapshot, we've had a couple of rounds of call for proposals, and in total, we received $30 million in requests from more than 3,000 applications from 131 countries. Needless to say, it was a bit overwhelming, and unfortunately, we couldn't possibly meet that degree of need, but we were able to mobilize funding and allocate over $3 million, $3.2 million US in grants to 310 groups from 102 countries, as you see here. And we estimate that about 145,000 people were reached. Obviously we wish we could do more, and we will continue to try to do more. But at least we felt that we were reaching some of the most urgent situations. The requests really spoke very clearly to the urgent humanitarian crisis that was sort of emerging among our communities, particularly the most vulnerable among us in our communities around the world. This next slide just provides a quick snapshot of the the different aspects of need that were represented through the applications. As you can see here, health needs, including mental health and food, were together made up about 50% of the requests. This is a total this is the second round. The first round, actually, food was more than half alone of the requests. So what we saw was a sort of shift where healthcare needs started emerging as also very important. And then you can see the other areas as well here. This is just a very quick picture of geographically where our applications came from. As you can see, more than half came from sub-Saharan Africa. And then finally, I just want to mention that in October, we launched a third round that had a very specific focus on addressing vaccine equity. And we have received 260 applications. They're currently being reviewed, and we hope to allocate funds in January. What's been interesting so far is seeing that, where vaccines are available, barriers still exist for many in our community, and particularly for transgender persons for example, whose gender markers may not match official documents to be eligible to get vaccine. Also, we have read quite a bit about low vaccine awareness, and specifically about myths and rumors, which I think all over the world, we're all in our various settings contending with myths and rumors about the vaccine, but actually specific myths and rumors about the vaccine being targeted at LGBTIQ people to harm them. So this is something that we hope to learn more about. So I'm going to exit my screen and turn to our discussion now. What I'd like to ask each of you, just to start off, and each just take maybe 5 minutes or so, is just to share with us a little bit about what led you to apply for the funds, and how did you determine what were the most urgent needs, let's say, maybe some of the challenges that you faced and what you were able to accomplish. So Sharon, would you like to start?
Sure. So Triangle very quickly were able to determine what the most pressing needs were, and and obviously what the greatest challenge for us as an organization was. We have a part of the organization's program is providing direct services, and nutrition and healthcare are part of that. And very quickly, I mean, very quickly, in the hard lockdown initially, saw the city's response, and then broader than that to the groups that we reach, both in the Western Cape, the Northern Cape, the Southern Cape, saw how it had a dire impact on the LGBTI community, peri-urban, urban, and also rural. And so, for example, where the organization had always provided nutrition, for example, had funding to provide nutrition for 100 people, that escalated by 280%. And the organization could never have met that, demand. And that is what led us to apply for the grant. And we could not have been more grateful that the turnaround, that it was so quick. It was 60 days into the pandemic. It was quickly, the turnaround was quick. The challenges we faced were many, as I'm sure it was with everybody else. The city's response in our context, particularly to the unhoused, many of the unhoused who are transgender women, who are also sex workers, who were very restricted in their movements, who are also some of the most ill amongst us. They were also the people that we saw dying first. So we had many deaths in the first wave of the pandemic. And we also saw then that had its own implications. Many do not have family support. Many do not have anybody who cares for or about them. So it had implications like burials and memorials and what happens to the body. It also it highlighted older LGBTIQ people who were isolated, and where one partner died if there was two people or people in a relationship. One contracted COVID, the other survived, or neither survived. But, home-based care and palliative care all of a sudden became a big thing. We saw how closely related. It was interesting to see your graph, how food and health were so closely interlinked. It brought many challenges. And one of the biggest ones, and I'm sure others will agree, was the toll that it took on staff. Because at the end of the day, it's staff, it's human beings that are carrying out this work. And it had an enormous impact on staff who for 2 years have worked tirelessly to continue to deliver all services that we deliver to people.
Thank you so much, Sharon. Yeah, you really highlight, I think, a key point, which I hope we can maybe circle back to, which is how your organizations are continuing to sort of, serve the needs of your community, facing themselves such stress under the circumstances. Let me turn now, Binta, in Liberia. Could you share a bit about your reason for applying for the funds and what you were able to do with the support, and in general, what the situation is in Liberia? Thanks.
Thank you so much. Firstly, I would like to say thanks for this opportunity, and thanks to Outright for being just on time when we were really in dire need. So just during the heat of COVID, we realized that LGBTQ persons who were so vulnerable were in need of getting food items or other sanitary items. During the first call for proposal from Outright, we applied to address those issues, but during the process of applying and sending the application and waiting, we realized that we needed to take action immediately. So we were able to raise funds amongst ourselves, like friends or people in abroad, to help the community. So we were able to raise funds for 40 LGBTQ persons in terms of feeding and sanitary items. So just when the second call came, which was the second call from Outright, which was to, you know, do something more sustainable, we realized that the food items, the things that we gave them were like already depleted, like people already used them. They were not sustainable. We realized that we had to do something that they would be able to sustain themselves, which was to create opportunity like alternative livelihood skills, so they can be empowered and actually be able to pay for some of their needs and all of that. So we were able to apply, and we got the funding, and we did like 5 different skills training. We did tie and dye, one I'm wearing right now, from some of the recipients. We did like other things like baking and catering. This lasted for like a week, but like we were really surprised to see how, you know, this impacted the community like positively, and how people were like, in the beginning they were hesitating, like, am I going to learn tie and dye in 5 days? And we were like shocked, the feedback, the positive feedback that we got. Like people were so excited learning these new things, and they could tell like they could make money from them. So we were able to support 50 LGBTQ persons. We had to even include some living with HIV, and also some with disabilities. So what we accomplished from that was also like starting them up with the seed funding, that they could be able to start up something small to sell. And also like we were able to address some social needs. Like COVID just brought up a lot of issues around mental health that we have been ignoring. Like a lot of us face so many different stuff. Like I suffer from depression and anxiety, but like COVID made me realize that it was actually happening. So we were able to address most of these issues. People learn how to cope, learn like techniques to be able to cope with stress and trauma. So yeah, some of the challenges we had was like we had inadequate funding, but like we underestimated some of the costs, which was like trainers and all of that. So how we overcame that was to actually source out people from the community who knew these skills, like who knew how to make tie and dye, and we could compensate them with the little that we could afford. And they were like very happy to help. So like it was so great that at the end of that, we got like some funding from, we got like a request to apply for funding to do a second batch of the livelihood skills training. So yeah, I'm really grateful. We are all really grateful for this opportunity.
Thanks so much. Thank you, Binta. And you also raise a really important point, because the nature of an emergency fund is that it is dealing with immediate needs and not necessarily looking at kind of long-term sustainability issues. And so your example, I think, is really important about how you can kind of combine emergency and support, as well as maybe planting some seeds for longer term support. Dana and Yasmin, I'll let you decide who will speak, or maybe you both will, but how about sharing with us your story?
Hello, everyone. Thank you, Amy. So my name is Dana Ash, and I'm the Executive Director of Haven for Artists. Yasmin is the Creative Director. I just want to give you a little bit of context about Lebanon in general. We've been going through, since 2019, we went through the October Revolution, then COVID began. So at that point, we had already had the financial crisis and many different things involved. So we were, in a way, already scurrying around trying to find ways to ensure that the community had the needs met, especially when it came to food and hygiene, access to clean water. In Lebanon.
Can I interrupt just for 1 second? Can you speak just a little bit louder? I'm getting a message that people are having a hard time hearing.
Sure. Is better?
Thank you.
So during the COVID, for the start of the COVID pandemic, we originally came together with multiple organizations to do a fund basically to raise money to buy food and hygiene kits to distribute quickly to the community. We did that with a coalition that we had originally just done as a fundraiser, come together, we raised the money, and we distributed within, I think, a month. The money was in and the food and everything was purchased and distributed right away. Unfortunately, in the context of where we live in Lebanon, we had the financial crisis, we had the revolution, we had COVID-19, and pity a nation that puts a global pandemic in the backseat next to one of the third largest non-nuclear blasts in history. So basically our capital was absolutely destroyed within a 10-kilometer radius. So there was 300,000 houses absolutely not just damaged, but unlivable. There were to today, we're still losing people. We are at currently 221 persons that have been murdered through this blast, because that is what it is. It was a murder. And it is to this day a crime scene. So the Beirut port blast in itself put everything into a very different perspective for us, because we weren't just dealing with COVID, of keeping people in their homes so that they could be safe and not catch this, but we had to scurry to make sure they had homes, since most of the city was completely destroyed. So we turned our offices into a shelter. We closed off all of our glass and windows as quickly as possible. We were able to house 6 LGBTQI individuals and 2 migrant workers. We were then able to help repatriate back to Ghana because they couldn't stay after the trauma they endured. We also were able to relocate the 6 individuals into new homes, because we understand that a shelter is not the same as feeling some stability of a home that is yours. So within a month, we were able to relocate all of them into new homes until their houses were rebuilt. And we did that for the past year. We've been working on relief alongside a lot of different things, because in the context of Lebanon, we cannot separate relief itself, which is reacting to the Beirut blast and the needs of the community, but also realizing that we were in a financial crisis with a 3,200% appreciation to our local currency. We had the blast, we had the revolution, we had 3 resigned cabinets, and in total, with a total of 45 days actual active government in the last 2 years. So civil society and organizations and activists are doing more than just reacting to COVID. They're reacting to a failing government, to a failing infrastructure, and to COVID, and to the blast on top of that. So we've been continuing this work, and through the support of Outright, we were able to expand what we were doing with Yellow Care, which is to create the Yellow Care report, which is the first of its kind to cover livelihoods, shelter assessment, understanding coping strategies, food insecurity, scalings, understanding everything about our community. And it's the first of its kind to happen to this scale, because no other organization has done it. And this coalition, being that we were 8 organizations coming together, had the capacity to reach out and create that trust between us and the community, to ask these questions and get direct answers on it. We'll be releasing the report hopefully this week, thanks to the support of Outright. And of course, part of the support of Outright was also the distribution of the relief. We raised we as Haven raised $100,000 in direct aid that we were able to distribute as medical, food, and direct cash. We paid rents, we rehabilitated houses, we fixed storefronts. We worked for a year and nothing but on the ground shelter rehabilitations, medical assistance. To this day, we're still paying surgeries that were affected by the Beirut blast itself. And through the Yellow Care report, as we were distributing, we'd ask these questions and we'd do these assessments, and we were able to get a total of 310 LGBTQI individuals to answer these assessments and surveys. And we will be releasing the report, but just to give you a little bit of an understanding of how dire the situation is in Lebanon right now, 9.1% of the LGBTQI community in Beirut lost its jobs just because of the Beirut blast. We're not talking COVID, we're not talking discrimination, we're not talking 9.1% lost their jobs from the blast. We currently have 46.1% of our community borderline when it talks to the food security scaling of the World Food Program. We have 62.8% of our community unemployed. We have 67% of trans women saying they feel unsafe physically and verbally in their own neighborhoods. We're not talking general city. There are so much data and so much information. And when the report comes out, it'll be a very, I think, the tool and the direct knowledge that organizations, civil society, stakeholders, donors need to know to where can they intervene as quickly as possible. Because what we're calling the report is not a report, it's a call to action. And this is what needs to happen in Lebanon.
Wow, thank you, Dana. I mean, I think we're all sort of shuddering to imagine the complexity, the complexity of the environment that you're working in with all of these crises sort of converging, building for a long time, and all really coming to a dire point at a similar moment. And yes, we will be really anxious to see your call to action, and for all of us in the global community, actually, to know how we can support you all. Thank you. So let me turn now to Bea. I'll hand over the microphone to you to hear your story.
Muchas gracias. Como representante de Laura Inter voy a pasar a compartir sus escritos, los cuales indican así. Mi nombre es Laura Inter, fundadora y directora de Brújula Intersexual. Agradezco mucho a mi compañera Bea y S por dar lectura a las respuestas que preparé para este evento. Desde hace 8 años, cuando inicié mi trabajo como activista intersexual, decidí llevar mi activismo mediante un seudónimo y no hacer pública mi imagen por motivos personales, por situaciones relacionadas a mi seguridad y como también una forma de protesta a la sobreexposición que se hace de nuestros cuerpos con características intersexuales en los hospitales de todo el mundo. En Brújula Intersexual contamos con distintos grupos de apoyo para variantes intersexuales específicas. Uno de nuestros grupos más numerosos es el de una variación intersexual conocida como hiperplasia suprarrenal congénita, que actualmente cuenta con más de 630 integrantes de prácticamente todos los países latinoamericanos. Algunas personas con hiperplasia suprarrenal congénita enfrentan riesgos relacionados a ciertas condiciones de salud. Por lo tanto, requieren ciertos medicamentos y durante la pandemia del COVID-19, muchos de estos medicamentos escasearon o subieron mucho de precio, por lo que muchas personas tienen que importarlos a altos costos o no pueden comprarlos. Las personas intersexuales también nos enfrentamos a graves violaciones de nuestros derechos humanos, como lo son las cirugías genitales médicamente innecesarias en niños y niñas intersexuales, que han sido descritas por las y los sobrevivientes como mutilación genital intersexual. Es común que las personas que fueron sometidas a estas cirugías en la infancia sufran secuelas graves en su salud y deben recibir atención médica urgente y constante para toda su vida. En los países latinoamericanos, muchas personas no cuentan con acceso gratuito a la salud y atención médica privada es demasiado cara para el ciudadano promedio. En el caso de las personas intersexuales, las experiencias de estigmatización, discriminación y trauma agravan esta situación e implican varias situaciones. La discriminación que sufren muchas personas con motivo de sus características sexuales tiene como resultado de que la mayoría vive en la pobreza, sin un trabajo estable, sin acceso a la salud. Muchas personas viven al día a día y con las recientes medidas de aislamiento se han visto impedidas para trabajar. Otras personas viven aisladas de su familia y amistades que en situaciones extremas como esta les deja solas enfrentando esta crisis. Debido a la falta de recursos y al aislamiento, muchas personas han abandonado la atención médica y psicológica que recibían. Otras personas están incomunicadas, sin contar con recursos para tener acceso a Internet. Algunas personas de la comunidad intersexual han contraído COVID y todo esto implica gastos para los que no estaban preparados. Determinamos cuáles eran las necesidades más fuertes de nuestra comunidad mediante encuestas que realizamos en los grupos de apoyo con los que contamos, ya sea mediante internet o por llamada telefónica. En la encuesta preguntamos sobre la situación económica de la persona, si tenía necesidad de ciertos medicamentos, los costos de estos medicamentos, así como también sus necesidades de comunicación, vivienda y alimentación, etc. Muchísimas gracias.
Thank you, Bea, and also Laura. Yeah, I mean, again, I think you're speaking to a situation where the pre-existing pre-COVID circumstances for many intersex people was already difficult, and then with COVID, the predicament that people find themselves in becomes even more difficult and complex. So let me change a little bit, just sort of looking now currently where things stand, because all of you had, you know, missions and goals for your work before COVID, and COVID has intervened. And so one question I have is sort of how is the pandemic continuing to affect the what was the primary work that you had before COVID? How are you managing that, and what are some of the strategies that you've been using to kind of continue, whether it's advocacy or service provision or other forms of support and engagement with communities, even in the, you know, our current situation? Clearly, we're in a marathon. You know, now I think the world is realizing this situation's not ending anytime soon, unfortunately. Maybe, Bea, could I start with you this time?
Ok, muchísimas gracias. Un desafío fue el hacer llegar el apoyo a las personas que viven en Venezuela por las restricciones del gobierno venezolano. Así que te estuvimos buscando opciones y finalmente el apoyo tuvo que depositarse a una persona en Perú que posteriormente le hizo llegar el apoyo por medio de un banco que también tiene sucursales en Venezuela. En algunos casos era muy complicado conseguir los medicamentos y gracias al apoyo de una persona en la comunidad que es farmacéutica, pudimos gestionar la compra y el envío de los medicamentos a algunas personas. Básicamente, con el tema del COVID y en la actualidad, esto se sigue complicando, ya que muchísimas personas, debido a la crisis que afrontan sus propios países, la hiperinflación o inflación, hace que cada vez sea más complicado llegar a esas personas. Incluso las cantidades que se les envía muchas veces se reducen por la misma inflación que pasa. En Perú, por ejemplo, a mitad del año llevamos el 50% de la inflación y en Venezuela obviamente se conoce la situación que es muy complicada y las restricciones monetarias que ponen los gobiernos también hace complicado llegar hacia estas personas para poderles ofrecer el apoyo que estamos obteniendo gracias a ORRE. Eso sería todo. Muchas gracias.
Yeah, that obviously complicates things enormously. I wonder, I mean, Dana and Yasmin, since you're also facing this kind of financial crisis and steep inflation, if you also want to address the question and how it relates to the ongoing crisis that Lebanon is facing, and how you continue to do the work that you were founded to do, actually.
So Haven is an organization that focuses on arts and culture mainly. Of course, during the crisis, we had to diverge our focus, whether it was COVID or the bomb. We were really trying to support the community with its direct needs and its most essential needs. And for the first year of COVID, it was still not the main challenge, to be very honest. We were still trying to see how to create safe spaces and how to support the community after the blast. And I think now what we've realized in Haven is that whether it's the blast, whether it's COVID, our agenda, the queer agenda, keeps being pushed and delayed. It is still illegal to be queer. It is still punishable by prison to be queer in Lebanon. And so what we try to do, how to answer to both COVID and the blast, and make sure that our goal, and we're still focused on our goal, and we're still trying to push and put the lives of queer people and women first in Haven's work, was to firstly open a center, a safe and free center for the community that includes a big garden. Beirut, before the blast, never had green spaces, and now the public space is still a very dangerous, even more dangerous space today. And with the financial crisis, with COVID, there are really scarce spaces for the LGBT community. So we opened the center. The center is completely sustainable. We're also facing electricity issues, unfortunately, in Lebanon. So we made sure that the center is sustainable. It has internet access, electricity access, and it's a space for the community to heal together from COVID and the blast. And the other focus that we're trying to work on now is the queer book that we are producing. It is a counter archive, and it is a way for us to take control on our narrative, the narrative of queer people that are coming from the region, and to show the intersectionality of our issues, to show that the challenges that come with being queer in a country like Lebanon are always much compounded, and it is really important to still put our expression and our lives first, regardless of the issues that we are facing on a public scale. And so these are the main two focuses of Haven right now. So to really work on a center where the community can be together. After the blast and COVID, I think we are down to almost 2 to 3.
We have a
community
total,
centers.
No, we have one community center, yeah,
And shelters, yeah.
and one club that's still LGBTQI. Actually, the last bar even closed 2 weeks ago.
Yeah.
And Oxfam released a report where the LGBT community officially has no safe spaces in Beirut, which is the safest place for us in the region, in Lebanon at this point. Which entails that the community center will act as a safe space, like Yasmin was saying, but also a cultural hub, a space for them to reorganize, to come back together, to reconnect, especially since many of us after the blast had to return to our family houses to rural areas. We had to face different discrimination trying to find housing with the current financial crisis. Prices are skyrocketed and medicine, along with fuel, is out. So like the book itself is making sure that we have control of the history and control of the narrative, and the space, as Yasmin perfectly said, it is a space for us to come back and heal, and hopefully be able to take on the fight.
That is. I mean, that's amazing that you've been able to do that under the circumstances, but also so important. We've definitely heard a lot about the fact that the loss of safe spaces, but even more than that, as you were saying, the kind of relegation of our issues to a back seat, in the face of so many crises. And so how do we actually keep the focus on our issues and how to continue to prioritize and keep visible what our various and diverse communities need? So that's thank you so much for sharing your work. Sharon, can I go to you? Could you talk a little bit about sort of where you see things now and going forward from here?
Well, we're in the fourth wave now, and it just breaks my heart to listen to the other speakers. And I'm from South Africa and from Cape Town, of all places, which may sound like, the gay capital of the world, and yet we still have rapes and murders as a regular occurrence here, just on the grounds of your orientation, identity, or expression. So, paper rights and lived realities are two different things here. And that is something that we contend with now. So in this period, what we've seen is a real spike in violence, in violent crimes perpetrated against LGBTIQ+ people. In 2021, we've lost many, many lives of queer people. We've seen the rates of intimate partner violence and other forms of violence spiking. And as I say, many cases of rapes and murder. And another thing that I also wanted to highlight, and it comes back to the staff, and I think, I don't know if it's a Western thing, but often in activist spaces, when we talk about self-care and how we care for ourselves as activists, and I'm really loath to speak to it in those kind of terms, because I think it requires communities of care, because I think all of us are so burnt out. All of us are feeling it at the end of 2 years. And recently, and as recent as the last couple of weeks, our health service, who does the outreach, the palliative care, the distribution of food, two of the staff members that fall under my program were hijacked at gunpoint. So they had guns held to their head and held there for heaven knows how long. And there went our vehicle and 2 highly traumatized staff. And these are people that have worked tirelessly for 2 years, you know, and have felt the impact, because when you do, all of us know, when you're doing this work on the ground, you're looking into faces of people who are hungry. You're looking into faces of people who are dying because of their health status, on top of COVID, on top of poverty, on top of homelessness, on top of so many things. And so you're not just going to drop off a food parcel or deliver a service. You are interacting with a real person. This has an impact on all of us who do this work. And then this happens, you know, so it sets us back in several ways, and yet we continue. And this seems to be a feature. This later, with the other day, speaking to another human rights organization, not in the LGBTI sector, we are the third, apparently, in the human rights space that has been hijacked in recent times. And I think it speaks somewhat to the, you know, to the dire need, to the poverty that exists, to people's, you know, they know you're carrying food, they know you're carrying supplies, they know you're carrying something, and you become a target, you know. But on a happier note, I was so inspired by what Binta was saying too, and with this latest grant, we also started a food garden project that is just in the beginning stages, but you know, we also need to start thinking we cannot sustain this amount of people that we currently reaching, certainly with nutrition. And the food garden project has been wonderful. And then we had the offering and taking it up, and it's in radio. So we're going to have a 2-hour slot on radio once a week, and then expanding that to other forms of art as not only as an advocacy platform, but also as sustainability, you know, self-sustaining, that people can perhaps learn new skills and develop new skills and things like that. But I'm so humbled by listening to everybody else. Yeah.
Thank you so much, Sharon. I mean, I think you were previously speaking about what is, I think, the reality for so many is a real desperation, and it manifests in all sorts of different ways, whether it's those who are driven to perpetrate crime or those who are victims of crime. And it is a horrible reality, unfortunately. Binta, and I'm just saying we've got about 6 minutes left. So Binta, I want to give you plenty of time to answer this question. And if we have time, we have one question in the Q&A that we'll try to reach as well. Go ahead, Binta.
Thank you all so much. So I just want to say that as today's day, like the community is still suffering from like inequalities, especially when it comes to the vaccine right now. Like we're seeing a lot of the same things that happened during the heat of COVID, when government was giving out food items and other things to other groups. Like we were left out, and there are no information actually reaching the community. Like we are the ones responsible to give out information about COVID-19, about the vaccine to the community. So a lot of that is happening. And we also see that the mental health thing is really affecting our work, especially when it comes to our target groups. So what we have been able to do is like continuing our advocacy, but through sports. We found out that a lot of trans men are into soccer, and it just kind of like brings out, you know, some kind of relief and joy seeing them do that, or even like interacting with each other, and it's also in an open area. So Right now, most of our work, we cannot do it indoors because of COVID restrictions. So we found out like doing those kind of outdoor activities is like really helping us. And it's really like we're still doing our work, but we're also like having fun while doing it. So even with the staff, like we have been having mental health breaks, like awareness sessions and stuff like that, just to be able to not burn out when you see what's happening out there, and even you are affected as well. So we've been, trying to do more of that, even with the volunteers and with the staff and with the community. Thank you.
Thank you. We just have about 4 minutes left, and we do have one question, but I think, I'm sorry to the person who asked. I think actually I'd like to go quickly around one more time, each giving you a minute or a little bit less. Just any other points you or issues you would like to make the audience aware of. I think one of the things I'm hearing is just the ongoing and really significant need for support. So if there are donors tuning into this, I hope they're paying attention to this as well. But just quickly, each of you, if you wanted just to say a few last words before we close, anything you'd like, really. Bea, would you like to start?
Ok. Bueno, gracias, verdaderamente gracias al apoyo que se recibió de OCRAI en 2020 y 2021, hemos logrado brindar alrededor de 150 apoyos para necesidades básicas de salud, vivienda y alimentación a personas intersexuales de todo Latinoamérica, incluyendo todos los países y el Caribe. La mayoría de las personas apoyadas tienen hiperplasia suprarrenal congénita. Yo soy una persona beneficiaria de este apoyo de OCRAI y también transito por hiperplasia suprarrenal congénita y estamos muy felices de poder contar con ese apoyo, con esa gran voluntad de querer apoyar en medio de esta crisis sanitaria que venimos viviendo. Como decían de por sí, antes a la crisis ya veníamos con una situación complicada como comunidad intersexual, que luego se vio mucho más agravada con esta pandemia de COVID-19. Y bueno, gracias a su apoyo hemos podido de alguna manera aplacar el sufrimiento, el dolor de muchas personas a nivel Latinoamérica y el Caribe. Así que muchísimas gracias por eso. Eso es todo.
Thank you, Bea. Just quickly, Sharon, how about you?
I too just want to say thank you. It required a quick response, and that is what we got. You cannot look in the face of somebody hungry and hope to have good health outcomes, mental health outcomes, physical health outcomes when you're dealing with multi-layered problems based on inequalities and oppressions which were highlighted by COVID.
Yeah, so true. Thank you. Dana and Yasmin. Oh, I think you're muted.
We want to thank Outright for the support, especially in the last year. It's been immensely needed and necessary to be able to continue the work. Hopefully we'll be able to open the community center and launch the book and be able to come back together as a community to both imagine and accomplish a better reality in a situation for us.
I hope so. I hope so. And Binta, last word from you.
So thank you for this opportunity, but I'd like to suggest that if it's possible, Outright could put the recipients of the COVID grants maybe we could get to know each other, the different organizations, and learn about the best practices during their response, and see how we could collaborate. Even if it's just learning about each other's work, that would be so amazing. So, all right, please make that happen. Yeah, so that would be really amazing, and we'll get to learn a lot about the different works and the different responses that has been happening. Thank you.
That is a fantastic idea, one that we will take to heart. And we need to close so that the next session can start. I can't thank you all enough for being willing to speak with us today. And I wish you all the very best. Thank you so much.